Hi, I'm Dr. Katz, and I'm here for a quick tutorial and demonstration about how Feeling Good Now, the therapy tracking application, works. You can see the application on the screen right now, and this application was developed by therapists for therapists to be very professional, simple, and easy to use with your workflow. It is based entirely on the work of Dr. David Burns, and it uses Dr. Burns' scales, all research validated, including symptom scales and session evaluation scales. It integrates symptoms scales for depression, anxiety, suicidality, anger, positive feelings that include like self-esteem, as well as relationship satisfaction, together with before and after session, and an evaluation of the therapy session at the end of the session, all designed to take very, very little time. So the idea is for it to take zero time for the therapist and to take maybe 2 or 3 minutes for the patient outside of the therapy room. This app is entirely web-based and is accessible for the therapist and the patient from any device, smartphone or iPad, so it makes it very versatile and easy. And I'd like to demonstrate to you today how it works, and so you can get a feel for it. I'll start actually with the patient side. So the app is divided. There's a patient's and a therapist side to the app. And I'll start with showing you the experience from the patient's perspective. So say that I'm a patient and my name is Patient Jack, and I'm going then into the app. I just navigate to Feeling Good Now, and then I can just sign in. And so I'll sign here as Patient Jack. And this is just a mock email address that I gave Patient Jack and credentials, and I'm signing in. And as you can see here, it'll give me a one of two options: before session and after session options. That's all. So very, very simple. Not many ways to get lost for the patient at this point. And he's doing it from his own smartphone or device. So before the session is where we are now. That's what I'll show you. And you can see that the survey comes up, and I'll just fill it up here real quickly. Let's say that I'm a patient not feeling particularly depressed, maybe a little bit of low self-esteem, and maybe a little bit of loss of motivation. And other than that, I'm doing pretty well, not feeling suicidal at all, and feeling maybe a little bit more anxiety for the sake. And just go quickly fill it up, kind of ignoring my anger. Usually is easier for us. And feeling pretty good about myself, let's say like a lot on all of these measures. Just quickly filling it out so you can just kind of get a feel of what would it be like for the patient. The last scale that I'm filling out is relationship, and let's say I'm very satisfied with my relationship right now. And I'm just going to put that in there. And you can see here that there is a yellow bar at the bottom, and it says answered questions. You still need to answer some of the questions above. So the patient will know if they're missing something. And so once I click this, you'll see that the yellow bar will disappear. And I can click submit. And that's it. It says, thanks. We've logged you out to protect your privacy. Enjoy your session. And the patient is now ready. So that would be the patient's experience that you just saw for the before session. Now what I'll do is I'll go back to Feeling Good Now, just so you can have the therapist perspective. So say that now I'll be the therapist, and I'm in my therapy room, and Patient Jack just showed up and submitted it. I'm going to log in, maybe at the beginning of the day, or maybe just before the session, to the therapist part, and I'll sign in. And this has my credentials for my regular clinic, and I don't want you to see that. I'm going to put in a mock therapist, which would be Therapist Joe that I created for this sake. And I'm signing in. And you can see that this is my dashboard. I immediately have a dashboard. See, my name is Therapist Joe. And my current patients, the patients that I have listed so far are only Mr. Patient Jack that's here. If I have more patients, they will show up on the list here on the left. So let's assume patient Jack just walked in the door 2 to 3 minutes before the session, filled out the before session evaluation, and now I log in and I click on Mr. Patient Jack, and you'll see that the first thing that comes up is Patient Jack's chart and his current brief mood survey. So this is just what I filled out as Patient Jack a moment ago, and you can see the result here, and we can talk about it and connect over how he's doing, how he's not feeling super depressed, but maybe a little bit of low self-esteem and feeling a little bit more anxious than anything else, maybe even frightened. And we can talk about that and see if that's what he'd want to work on today. We can, so this is basically your dashboard, and it also serves as an electronic medical record. So you can see here that the therapy notes are here. So I can add, I've seen patient patient Jack yesterday, and I've seen him 3 times yesterday, so I have 3 notes. And now I'm going to add another note saying, doing somewhat better today. And then I'm going to assign some homework and etc. and just add the note. So now I have a note from today. And the last thing another thing that we have on the dashboard for Patient Jack, remember we have the recent survey that pops up just immediately as you click on his name, is therapy progress. So you can see here is a cool feature where you can have a quick glance in kind of a graphic way. It's obviously not a graph, but it visually allows for you to kind of get an assessment of how he's doing before and after each session for the most recent sessions. That's available to you to see. It stores basically all of the data, and when you have more, you can scroll and go back. We have a legend here. You can see here that before session is yellow, after session is green. So yesterday when I supposedly saw Patient Jack, he didn't have much of depression, maybe just 5 out of 100, 5%. And when he left the session, he had 0, and then you can go further down. So these are on the left are the before session, after session, before session, after session, which you see he didn't fill out here. And then again, before session and after session, etc. Now he's coming to us, and this is the most recent, which you just saw before, which is how he's feeling right now. And you can also take this opportunity, as you're reviewing this therapy progress, you can actually check what were the comments and how was the evaluation of the therapy session. This is on this part. So here I was leaving it, Patient Jack was leaving it kind of vague, like least, nothing, like best, everything. And if I choose, I can engage with him on that statement. Maybe say, how hard would it be for him to talk to me about something that he didn't like about the therapy session, etc. So once again, we have recent surveys, the immediate survey that was just filled out today. We have therapy note, and we have therapy progress. The last feature that I'll show you on Patient Jack's chart is that if he shows up in your room and you'd like to give him, and he hasn't done the brief mood survey, the before session evaluation, you can ask him to log on his phone, which is simple enough. And actually most of my patients now prefer to do that. And then they know next time to not take time out of the therapy session time and use their phone before the session time to fill out the survey. But if they don't want to, or you want to help them out, or they don't have a phone, whatever, you can also give them your iPad if you have one that you're writing on. That's how my system works. It's on an iPad, so I can just give them, from their chart, can click on that, and this allows them to just fill out their before session survey from my device. Sometimes it's useful. So that's all I wanted to show you about Patient Jack's chart. I do want to show you one more thing on your chart, on your dashboard. So let's I'll just navigate backwards because this is just a web app, so it allows me to do that, to get back into my dashboard. And here I am with my patients, with therapist Joe's patients. What I wanted to show you is how do you invite patients. Patient Jack has been invited, but now I want to show you how you invite patients. To invite patients to participate, to use Feeling Good Now. The way to do that is by using this blue button here. Clicking on that will get you into an email body, and it tells you, gives you all the information. You actually, for now, will need to copy and paste this into your own email and send this email to whatever patient you want to send it to. Now, if you look closely, you'll see that it says, please click on the link below to quickly set up your account on Feeling Good Now. This is what the patient will receive. And please make sure to fill out the before session evaluation before your visit. So it already sets it up. You can kind of get it started, and it's pretty direct and simple and very easy to understand. You can also see here that on this link itself, it says your name here. In this case, it's Therapist Joe. And this is basically how the system knows to connect this patient to your chart. So once this patient clicks on this link, it will, and signs up, his sign up will automatically go into your chart. And this is how the system actually knows that you guys are connected. Very easy, zero to do for the therapist. Just send that email, patient clicks on it, and you're done, and you're connected. So that's how it works. If you have any more questions about Feeling Good Now, you're welcome to shoot me an email. My email is maor@feelinggoodinstitute.com. That's MAOR@feelinggoodinstitute.com. And if you want to learn more about the early access program, of how we're trying to support therapists in using measurement in their practice, you can see that also on the application on the therapist side. It provides all the benefits and things like that. We are trying to support you. So those who sign up early will get basically unlimited clinical and technical support for the use of the measurement app and how measurement works in their practice. Thank you very much, and I hope this is useful to you. Let me know. Bye-bye.